Good evening, dear viewers, and welcome to a brand new episode of Medical Talk, where we bring you the latest insight from the world of modern medicine and beauty science. Today's topic takes us into the fascinating world of dermatology and aesthetics, where medicine meets artistry and science works hand in hand with self-confidence. Our skin reflects not only how we look, but also how we feel. And with the latest breakthroughs in dermatology, new technologies are helping people achieve healthier, fresher, and more youthful skin naturally. From advanced rejuvenation treatments to collagen stimulators, skin boosters, and even stem cell therapy, we will discover what's truly effective, what's safe, and how to keep our skin glowing from within. Dear viewers, joining us today to explore these innovations is Dr. Nafis Fatima Sayyid, a dermatologist and aesthetic specialist who will help us understand how to care for our skin in the smartest, most balanced way. So just stay tuned with Medical Talk to know more about our topic.
Global data shows that over 70% of adults experience at least one significant skin concern during their lifetime, making skin conditions among the most common reasons for medical visits worldwide. These concerns affect not only appearance, but also comfort and self-confidence across all age groups. Research confirms that the skin loses nearly 1% of its collagen each year after the age of 25, leading to gradual changes in firmness, elasticity, and texture. Environmental factors such as sun exposure, pollution, stress, and poor sleep can accelerate this process and increase the risk of early skin damage. Recent advances in dermatology focus on prevention and natural skin regeneration rather than dramatic cosmetic changes. Studies consistently show that long-term skin health depends not only on medical treatments, but also on daily habits such as sun protection, hydration, balanced nutrition, and informed skincare choices.
Welcome back to the program, and we are happy to have with us in the studio Dr. Nafis Fatima Sayyid, a dermatologist specialist and aesthetic specialist. Welcome to Medical Talk.
Thank you so much, Dr. Mohammed, for having me.
Thank you so much. I'm so excited. I have so many questions for you. Let's begin with the basics. What are the latest trends and technologies in dermatology and aesthetic skin care today?
Yes, aesthetic dermatology is a field that is rapidly evolving every day. Literally, just after this talk show, and probably by the time it's broadcast,
Indeed.
we'll have a
Exactly.
dozen other things
Exactly.
to add to this. But of course, we have to pick and choose the right ones. The most prominent is, of course, the newer the machines to treat all the skin conditions. There are stuff like 3D and 4D face lifting, and we have really nice lasers to treat acne and pigmentation, which was earlier not the case, especially the skin types in this region of the world, which was considered not very laser compatible. So now we have more advanced lasers to treat all skin conditions. And then of course we have collagen stimulators, which we didn't have earlier,
Exactly.
along with skin boosters. And of course stem cells, which is the new
Trend.
golden tool,
Yes.
which is great for pretty much everything.
Exactly. I'm glad that you mentioned those things because we're gonna delve into that later. But I want to talk about facial rejuvenation is one of the most requested treatment, I would assume. What are the best combinations of procedures? Because it is a combination of procedures you recommend for overall skin renewal and anti-aging results.
Yes, of course. Facial rejuvenation is a very broad term.
Yes.
So it's always a combination of procedures or a routine of procedures which has to be specific to the individual based on their skin needs and their skin type and their skin issues. So it's always a customized plan based on what the individual needs are. So of course the patient has to come in and the dermatologist has to examine the exact issues, and if it's also related to the internal health, so we can decide what is the best combination of procedures. Nowadays, of course, we combine the Botox and the fillers with collagen stimulators and skin boosters and mesotherapy along with stem cells, and also intersperse it with these lasers. So overall, when done regularly over a period of time, have really magical effects, but you have to be regular.
Exactly, and you have to be consistent as well.
Exactly.
And know exactly what type of skin you have that could actually, whether this would suit you or not. I have a confession. I have a problem with saying this word. Is it hyaluronic acid?
Hyaluronic acid.
Hyaluronic acid. Okay, because many people talk about it, and it's type of fillers, I would assume. There are still a lot of misconceptions about it.
Yes, of course. There's a lot of fear mongering and misconceptions surrounding fillers, when in fact it is actually just cross-linked hyaluronic acid gel, which is already produced naturally in our body by our skin.
It's actually
Of course,
it's a natural.
It's part of the natural extracellular matrix of the dermis of human beings.
Okay.
So what happened earlier was like bad quality fillers injected by non-qualified people in a bad way. Gave it a bad name and side effects. But actually speaking, it's just hyaluronic acid, which is also present in mesotherapy or skin boosters. The only difference being that it is cross-linked, so it will give you some form and last a little longer, which in fact is an advantage. Because when combined with collagen boosters and other collagen stimulators, they will have better results when combined with fillers in the right way.
I see. So it's basically harmless, I would say. If
When done in the right way,
When-
with the right technique, by the right person.
exactly. So okay, now we often hear the term liquid facelift, and I don't understand what that. Our viewers have questions about it. What does it actually mean, and how does it differ from traditional facelift surgery?
Okay, now you're talking about putting the plastic surgeons out of business.
No, it's not. I need to clarify because it is out there, and a lot of people have
Of
misconceptions.
course, and it's minimally invasive. The only thing, it's much less permanent compared to any other surgery, but of course with much less side effects or no side effects. So basically it includes all the procedures we do in dermatology, and I like to start with fillers in specific points like acupressure points across the face, like 8-point or 5-point lifting techniques, where you put minimal amounts of fillers in drops across the face to lift and contour the face. without giving you any visible volume or nafakh or a plastic fake look. So now we have gradually moved on from these very fake voluminous pillow faces,
swollen
where
basically,
everyone looking the same.
Yeah.
Now people just want to look like rejuvenated younger versions of their own selves.
Exactly.
So this technique is really helping us, which is called the liquid facelift, which we are doing using fillers, but also can be augmented using collagen stimulators and collagen boosters along with fillers in a routine as a process. So it's not just any one single procedure, but it's a series of procedures that results in this amazing anti-aging or lifted, contoured or youthful appearance, as you said.
Exactly. And I understand, and I really appreciate that, the fact that you mentioned that trying to look more natural, more normal, rather than more of a generic type of, because I would assume a lot of people, they come to your clinic and they say, look, I want to look like so-and-so. That's basically unhealthy.
Thankfully, that's changing.
Okay.
Yeah, in the past, post-COVID, at least, we have seen a major shift from the Kim Kardashian face to looking like more rejuvenated, and also we have more options now in terms of collagen stimulators and skin boosters and tools that we didn't have before.
Yeah.
So now we have so many more options to to improve the actual texture and quality of the skin, which itself is going to give, the Khaliji, naturally beautiful Khaliji faces.
Yeah, the Arabic,
nice, lifted, beautiful, naturally beautiful people here.
That's the thing, because each region, each country and each culture has their own natural or like a specific look, which is considered beauty. The beauty standard is different from one region to another. So as you mentioned, like what applies here might not apply to other regions, like say, for example, in Asia or Africa or in Europe.
But healthy skin is always in fashion.
Absolutely.
Yes.
It's the base for all our conversation. Let's move on to collagen stimulators. How do they work to rebuild the skin structure, and how are they different from skin boosters?
Yes, of course. Collagen stimulators are specific molecules like PCL, poly-L-lactic acid, calcium hydroxyapatite, PDL. Now, these are actually stimulating collagen and elastin in the extracellular matrix of our skin through a pseudo-inflammatory pathway. It's creating like a false sense of, like a pseudo-inflammatory pathway to stimulate the fibroblasts and the macrophages to produce more collagen and elastin. Something like also the needling procedure. Any kind of injury is going to stimulate the healing cascade and deposition of the extracellular matrix, hyaluronic acid, collagen, elastin. So this is the basic mechanism of action. So it's building your skin from within.
I see.
So this is without the use of fillers for those who are still anxious about using fillers. So it's going to give you that thickness and that lifting that is going to last a little longer compared to your skin boosters, which are mainly various combinations of hyaluronic acid. So the collagen stimulators have no hyaluronic acid.
Okay.
They are specific molecules on their own, which are stimulating, as I said, collagen, elastin through a different pathway by stimulating the fibroblasts and macrophages and depositing the skin matrix, thickening it.
So basically, it's giving you another option. Basically.
Another option and another completely pathway, but the end result, the goal remains the same.
We'll still have more questions, but we have to take a short break and watch a report. So we'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Nafis, Fatima. Dr. Nafis, before the break, we were talking about skincare in general, and we talked about the collagen stimulators. I want to move on to stem cell-based treatments. As you know, they're becoming a trend in aesthetic medicine. How do stem cells help in skin regeneration and rejuvenation?
stem cells is now the new magic, still under development in so many treatments, even systemic diseases, the stem cells. Of course, as doctors, we know them to be these pluripotent cells that can develop into any other kind of cells wherever they are applied. So it's a great modality to replenish and rejuvenate any area where they're applied to, because it can develop into the cells of that area or create more enriched or new cells in the damaged area wherever we are applying it, whether it's the skin, scars, or hair treatments. So surprisingly, we are having amazing results, especially for hair. We still have a lot of treatments for skin, but not so much for hair. So stem cells actually are, they are being taken from the bulge, and also we're getting synthetically produced stem cells, which are stimulating the process of replenishing and rejuvenating the original cells in the area, the keratinocytes in the skin, or the hair cells in the hair follicle. So it's really amazing. But apart from replenishing and rejuvenating, they're also having an anti-inflammatory effect, an antioxidative effect. There is a natural oxidation process that is going on in our body with cytokines and all of these MMPs, other things. So even this is kind of blocking that. It's blocking. It's anti-inflammatory, so it's blocking the inflammatory cytokines and the normal process of oxidation, which is part of life and aging.
Exactly.
So by blocking this again, there is a rejuvenation. We are healthier, we are looking younger for longer, or we are treating damage better.
Exactly.
So it's a magical new tool, and it's safe.
It's amazing about the stem cell and how it's the whole concept in the whole body, not just the skin, every organs, everywhere, that actually we can turn the clock back, almost like turning the clock back. But just to clarify to our viewers, from where do you get the stem cells?
See, there are human sources and animal sources which are not licensed here yet, but we are having plant sources, and then we have the patient's own blood, or we take like a punch biopsy from the patient's own hair, like a deep punch biopsy, where we are being able to reach the bulge of the hair follicle, and then we are processing it in these special kits that look like these PRP kits, and able to extract stem cells, which we re-inject back in this hair or skin of the patient, or the scars, or whatever requires rejuvenation, and over a period of time it is showing great results.
Yes. Now, beyond treatments, how important it is to maintain healthy skin from within through diet, hydration, lifestyle choices?
Of course, like we mentioned earlier, the skin is a mirror of our internal health.
Exactly.
So if we have any internal deficiencies or hormonal imbalances or any other health issues going on, one of the first places it's going to start showing is your face. For example, if you're anemic, you're going to have dark circles, which no matter how much we treat, you're going to continue to have them, because we are not treating the underlying cause. So it's very important to treat the underlying cause, the underlying deficiencies, the hormonal imbalances, the health issues, which do not let us achieve the most optimal results where skin is concerned, and also habits like smoking and other things which also completely nullify the results of anything we're doing for the patient, as they're completely antagonistic to everything that we are doing. So it's very important, internal health, and whatever it takes to keep that in the most optimal condition, which of course is also most important to our life.
Exactly.
And everything else is...
Absolutely. And during the break, you and I were talking about tanning, and there's this trend is going on in Kuwait. The people, they think that they're doing tanning. What do you say to that?
It's completely ridiculous. I can't imagine.
Especially for the young girls.
Yes.
Yeah.
They probably just close their eyes and think they're in Malibu or something. But of course, and it's so dangerous, and they're so young, they don't realize that the kind of damage it can cause. It may look glamorous at that point, maybe that sun-kissed look or that color, but they don't know what's going to happen to their skin over the next 5 years and 10 years and 15 years. And how old you actually look as just a 13-year-old with deep wrinkles, because there's going to be major UV damage in your face. So that is so dangerous. UV damage even alters your DNA.
Yeah, absolutely.
So it's carcinogenic.
Absolutely. Yeah. Skin cancer is a thing. It's a serious issue, and And maybe we are lucky, or maybe we're not. In Kuwait, we don't have like a very high number of that, but we are prone to it if we push ourselves to that. Some people tend to overuse beauty procedures or follow social media trends blindly. From your perspective, what are some common mistakes people make when it comes to their skincare or aesthetic treatments?
This is an extremely dangerous trend, and we come across with the side effects of this almost every day with our patients. We have very young women and kids following these influencers or beauty bloggers or whatever they call themselves, and they're literally people who have no clue about the skin anatomy, skin diseases, have no clue what they're talking about, and people are actually following them, resulting in serious side effects and serious issues. For example, over exfoliating the skin using chemical peels at home, unsupervised, and using all kinds of active ingredients which are not suitable for all skin types and not suitable at the intensity or intervals at which they're being used, and being used the wrong way. So this is in fact creating more damage than treating anything, and sometimes leading to scarring even. That's very serious. It's abrading the natural the flora of the skin, and it's very sad to see that, and it's very important to regulate this. I don't know how it's possible.
I don't know either.
But yes, as doctors, we can advise that go see your dermatologist, get your skin examined, and not just that. Every individual skin type is unique. So even if the advice is right, it may not apply to you, because you might have a different skin type or different skin issues. So it's important.
That's the key. Each individual has a unique skin type, which requires a unique skin care regimen. Basically, what's suitable for you might not be suitable for X or Y or Z. Now, I'm glad that you mentioned the young generation, because God knows we see like young girls specifically. They go to the shopping centers, and they go and they just ravage through these makeup stores, and they buy things that might not suitable for them. Now, my question for you is, for a girl like, let's say 13, 12 years old, what is the best skincare that they can do?
They just need to stay healthy, sleep, stay away from their screens, and reduce the screen time. I think that's the most detrimental. They're getting tech lines at 12, and dark circles, and which was never there when we were we were young. And our parents used to literally pull us back from outside, to come back home, and now we are pushing our kids outside to go and play.
Absolutely.
So you need to play, you need to exercise, you need to sleep, good nutrition. Just need to hydrate and use a good sunscreen. What else does a child need?
And I mean, because some of them, they say like I'm using a moisturizer, I'm using like a highlighter or whatever. They do try to play with makeup, and I'm fine with that. So too, sometimes they try to put some makeup on, just a little makeup on themselves. But how far can they go?
This is a trending subject, because while I may speak against it, my mobile is full of videos of my daughter makeup vlogging. It's bad. It's chemicals entering skin that is not fully developed yet. Delicate skin that is not,
it's growing, basically.
It's not compatible with that concealer. So, and then she applies that makeup better than me. But beside the point, it's unhealthy, and not these are endocrine disruptors. These are affecting the hormones of young women. These are chemicals entering your skin. They're endocrine disruptors. I mean, they're carcinogenic, God forbid, and God bless all the children and protect them always. But these are just the side effects of the times we're living.
I pray for the day where there be a regulation to, just like smoking, that you're not allowed to sell certain products to minors or underage kids. That would be the same thing. But again, it's going to be very, very hard.
Their mom's closets.
Well, I mean, this is the thing, it's not like smoking, as I said, and they actually can sneak in, they can borrow from their sisters, their mothers, and their friends and stuff like that. Before we finish, what is your personal advice to viewers who want radiant, youthful skin not just for beauty, but as a reflection of health and confidence.
Yes, of course. I mean, most importantly, your internal health, as I said, and your sleep and your peace of mind. Because sometimes you're exercising, you're eating clean, and you're healthy, and you have a toxic environment, or you are constantly stressed, and that's going to show up. I mean, stress shows up more than anything else, and it's the most undermined thing that no one talks about. And it makes you age faster, it makes you look haggard, and affects your health on the whole, and not just your skin.
Exactly.
So peace of mind and de-stressing
Yeah.
and loving yourself, so important.
Exactly. I mean, to be honest with you, I've had so many questions, but unfortunately that's all the time we have today. Thank you, Dr. Nafis, Fatima Sayyid, for sharing your expertise and valuable insights with us tonight, and hopefully we'll be able to host you again in the future with Medical Talk.
Thank you, Mohammed, for having me. It was wonderful talking to you.
Thank you so much. Dear viewers, we still have more to go. Stay with us. We'll be right back. Dear viewers, before we move to our family health tips, let's remember that good health always starts at home. Parents play a key role in teaching their children how to eat well, stay active, and care for their bodies. Health education isn't just advice anymore. It's a way of life that helps every family stay stronger and healthy. Let's watch it together.
Molar incisor hypomineralization is a developmental defect that affects permanent and sometimes primary teeth. From its name, it affects the molars and the incisors. It can be caused by several factors like genetics, problem with the pregnancy or birth, and childhood disease. It can look like different shapes, like it can be like a scratch on the tooth, or white spot, yellow or brown discoloration of the tooth. Sometimes it can have post-eruptive breakdown, like the tooth can erupt with a breakdown on the tooth. For the treatment of the molar teeth, early diagnosis and detection of this defect can save the tooth by simply doing simple procedure like protective coating, simple restoration, or sometimes stainless steel crowns. While leaving the tooth till it's become broken and cause pain and sensitive to the child, can end up by extracting that tooth.
And with that, we conclude tonight's episode of Medical Talk. Remember, true beauty begins with healthy skin, and healthy skin begins with knowledge and care. Thank you for watching us, and see you next time only in Medical Talk.